All right, good morning. This is Senate Health and Welfare. It's Tuesday, February 24th. And we're going to look at the latest markup draft of S-163. Jen, you want to walk us through it?
Sure. Jen Carvey from the Office of Legislative Counsel. I'm actually just going to start with the bill as introduced to remind you what this is, because the amendment is one very small instance of amendment. So this is S-163, an act relating to the role of advanced practice registered nurses in hospital care. You remember, we've gone through this one a few times. It specifically adds advanced practice registered nurses, or APRNs, to statutes on hospital patients' bill of rights and licensing of hospitals, and recognizing that for their scope of practice, they may be the person who is attending to a patient who, the attending provider for a patient who's in the hospital. So recognizing throughout that it's not just physician in a lot of these roles. The amendment itself deals with this underlined language here on lines 13 through 15 of page 2. This is in the hospital patient bill of rights. And it says that the patient shall have an attending physician, and bill adds for APRN, who's responsible for coordinating their care. And then there's a second sentence that requires physician consultation and support to be available to an attending APRN at all times in accordance with applicable standards of practice and regulatory requirements. And you heard testimony from OPR and others that language was not only not necessary, but actually potentially narrowed the scope of practice that is otherwise allowed for APRNs. So the amendment simply takes out the version of that subdivision that has
Whose amendment is it? Sorry. OPR.
I mean, it's
and the nurses.
okay. I mean, it's your whose amendment?
Where did it?
Yeah, I think OPR was the one who flagged this, and I think the parents were okay with removing that language, but I will.
I have no idea.
No, we talked about it here.
Thank you.
Yes, you're right. Oh, sorry. No, that's okay. I think the parents were comfortable with that as well. I won't speak for them, let them speak for themselves, but I don't think you heard concerned about that. So this is the amendment. It's simply in section 2, strikes out subdivision A2, which is the part of the second sentence, and inserts the move thereof a new subdivision A2 that just says the patient shall have an attending physician or APRN who is responsible for coordinating her care. So it takes out that second sentence. Didn't seem worthy of a straight all amendment.
And this doesn't change the fact that hospitals have their own bylaws.
Right, hospitals have their own policies, they have credentialing requirements.
Yeah.
They may have consultation or supervision requirements. So back up. Right, this doesn't change any of what hospitals are doing. It is really a recognition of what does occur and is permitted under existing law to occur. So again, that's adding APRNs throughout the Bill of Rights for hospital patients, anywhere a physician is, and updating some of the language in those statutes to get rid of gendered terms and just use non-gender terms like the patient.
That law is in the bill as it came
as it was in the yeah, and then some of the disciplinary language also recognizing right now some of the statutes are very specific to physicians who are licensed through the Board of Medical Practice, which does not recognize that there are physicians, osteopathic physicians, who are licensed through the Office of Professional Regulation, and then adding specifically a reference to APRN. So also then adding some references to OPR as the licensing authority. And then in section 3 is the hospital licensure requirements and certain minimum standards that a hospital must meet. And in that case, right now, the statutes say all patients admitted to the hospital shall be under the care of a state registered and licensed practicing physician as defined by the laws of the state of Vermont. This changes that to a physician licensed pursuant to 26 VSA chapter 23, which is the allopathic physicians licensed by the Board of Medical Practice, or 33 osteopathic physicians licensed by OPR, or an advanced practice registry nurse licensed under the specific subchapter for APRNs.
So OPR only licenses the osteopathic APRNs.
No, they license osteopathic physicians and APRNs, and a number of other healthcare professionals. The Board of Medical Practice licenses medical MDs, so different, slightly different training, but I believe same scope of practice as osteopathic physicians. So allopathic physicians, medical doctors, physician assistants, podiatrists, anesthesiologists, radiology assistants. That's the scope of what they license.
Oh, gosh.
Board of Medical Practice.
Board of
Board of Medical Practice is the MDs. So DOs are the osteopathic physicians at OPR. So when you go to see the doctor and you are seeing a physician, you may not know whether that physician is an MD doctor or a DO doctor, because they do the same things. But the MDs are licensed through Board of Medical Practice and the DOs are licensed through OPR. And then Board of Medical Practice also licenses physician assistants, podiatrists, I believe radiologist assistants and anesthesiologist assistants. I think that is their bucket of what they license. And then the osteopathic physicians, nurses, including APRNs, mental health professionals, many other providers are at OPR. I only know that we've been doing it a while.
Podiatrists, PAs.
I don't know. I not talk
Oh,
about
wait,
how the
because
ODs,
we
how
have
did
a historical
how did the
analysis.
ODs end up in?
DOs.
How did the DOs end up in?
Right, ODs are the optometrists.
Sorry.
They really focus on also OPR.
Lots of DOs.
So that's what I was gonna ask you. This is our proposal here, right?
So, well, then this is just the last reference in the bill to adding, that case records must be signed by the attending physician or APRN. And the act will take effect on passage. So, yeah, so the only amendment I have so far as we reviewed is that one small change to take out the reference to consultation being required as part of the hospital patient bill of rights, but does not change what a hospital may do to their own policies.
So really, this bill, what does this bill do overall?
This bill, I think, as I understand it, recognizes in the statutes that there are roles that APRNs are permitted through their licensure and scope of practice to perform in hospital settings, but the statutes currently refer only to physicians. So it's adding in the APRNs and as appropriate references to the Office of Professional Regulation.
I think so. I think, as I understand it, that a nurse practitioner could not be designated as the caretaker for an individual in a hospital, even if the hospital's rules said that they could. But statute doesn't say that.
I think as a matter of practice, that may be what already happens, because it's not so much that the statutes currently prohibit it, that they, in references to what is required for other purposes for satisfying the hospital patient bill of rights or licensing hospitals, that there is a physician in those roles, which is, I understand, is not necessarily consistent with current practice because of the scope of practice that is authorized by APRNs. There's a bit of a disconnect.
Okay. So what would the committee like to proceed with this, with the proposed amendment? I'm open to either considering a vote now, or we can hold off and vote at the end of the meeting today. Bright and early in the morning, although I don't think it'll be
I'll make a motion to vote favorably on past 163 draft 121 amended
First you want to vote the amendment. Then you vote the bill.
So I would like to make a motion to vote on the amendment of S 163.
Discussion on this, and Senator Morley obviously will. Part of the. Any discussion? Questions? Okay, where's our clerk? You're the temporary clerk.
Then just the amendment.
It's draft one, number 120. Wait. Yeah, draft 1.1 amendment. That's what we're voting on first. This was Senator White's. Okay. Which is 24.
Okay. So there it is.
Yes.
Senator Gulak. Gulak.
You're
You-
like,
I'll get it.
it took me 4 years to get it, so you're doing good.
Yes.
Senator Morley.
We'll wait for, we'll get it vote. Yes.
So we'll hold off on the action.
That's the amendment. Now we'll vote on the bill as amended.
I'll move to vote on the bill S 163 as amended.
Want to do discussion, Chair?
Right now.
Yes. Hold until Senator, gets back.
No, we'll vote on both of them. And you can break the tie.
We want this, let no use.
Oh, you big time. We looked at S 239 already. Last
It's
week,
not, be-
it's Katie.
it's Michelle. I think.
And there she is.
You could say wrong if you look, it's really problematic. Right, don't be.
I got it.
You got it off, you just did it. Nice.
All right. So.
Any further discussion? Okay, let's vote.
Good, Senator Benson, yes. Senator Cummings,
Yes.
Senator Gulak. Not. You like.
It's an I. I.
I know.
As if, yeah, yes.
Very quickly, we think about the vote. And Senator Lyon.
Yes, and then we'll hold both those votes for Senator Morley when he gets back from agriculture. And I'm actually looking for a reporter of the bill. And I think the only one who hasn't reported is Senator Morley. So we'll ask him if he would like to, and we'll maybe not have to listen to it.
Senator Kuhowski's name and my name offered a lot of humor to the Senate over the last couple of years, John, so you're fine. Try saying Kuhowski. That's not bad.
As long as I hear it just before I have to say it. So what is the official title of this?
The official title of the bill,
Yeah,
an act relating to the role of advanced practice registered nurses in hospital care. So
What we say APR.
APR and act relating to the role of APR and impossible exams. Confirming though.
He was always on.
Yeah.
That's right.
We'll ask him. I don't wanna put him in a bad place. Somebody else will do it. Okay, so welcome, Senator Hosky. Good to see you.
It's good to see you too.
On a difficult day, and we understand that. So, we did look at S 239 last week, and just to get an idea, maybe you could help us understand why you're introducing it and what benefit it will offer.
I can absolutely do that. Senator Tongowski, for the record. As I think is no secret, I am a social worker and I deal with mandated reporting, thankfully not often. But I am a mandated reporter. This bill actually though didn't come through my practice. It came as a recommendation from the Vermont Center for Crime Victim Services. And when they started talking about some of their concerns with our current statutes, I jumped into my social work role and realized that they were absolutely correct, that our laws around mandated reporting could really use some updates and really largely to make sure that they're doing what we intended for them to do. So I would certainly recommend having the Center for Crime Victim Services in to share their concerns with the current laws and how they have actually caused harm to victims, which is certainly not what we want our mandated reporting laws to do. They are intended to keep people safe, not do harm. I also will say that
That's Jennifer Pullman.
yes. I also do want to say that this bill came at sort of the last minute with the drafting deadlines. So I expect, and actually I'm coming to you today with a recommendation for a change to it. And that is that the the Office of the Child Advocate be added to the list of people taking part in the task force. And they did reach out to ask to be added. They very much acknowledge that they are very busy and they don't want to be on every task force, but they definitely want to be on this one. Our laws around mandated reporting really haven't been updated since the 1990s. And I think we've learned a lot since then and can really do some work. The reason this is coming to you as a task force and not recommendations is I felt like with the short deadline that I had and with the scope of changes that might be suggested, it made much more sense to give this to the experts to come back to us and tell us what needs to change. In trying to put this bill together, I did speak with some people and what really became clear is yes, changes are needed, but those changes need to be very carefully dialed in and really would be better suited with a task force. I am very much not generally someone who wants to just make a study committee and have reports. But I think in this instance, this is the most prudent way forward.
Good. And so, and looking at the bill, it's a pretty broad, having to look at statutes, rules and policies. It's a very broad
Yes.
request. So you know what rules are like to go through and what policies are like to go through. Some of those policies may or may not be accessible. So have you thought about trying to narrow or be more explicit about the request in the bill? Because we'll take your suggestion on it. You don't have to have them like off the top of your head, but it's something I think that would be helpful. Perhaps Matthew Bernstein and his group can help us with that.
I think Matthew can help. I also think the Department of Children and Families, Child Protection, people can help. Part of the reason it is incredibly broad is again, that things haven't really been updated since the 90s. And I think it is important that our laws, rules, and policies, when we're doing something with this scope and this potential impact, are really working in tandem. So it was intentionally broad, and I would suggest perhaps giving the task force more meetings and really dialing in who's on it rather than narrowing the scope.
Let them decide,
Yeah,
bring the group together,
yeah.
right? All right, we could, to the extent practicable.
Yeah.
Examine all of this.
Yeah, absolutely. And again, the makeup of the committee, I think probably needs some tweaking. Like I said, I've already suggested an addition.
Yeah,
But really making sure that we have the right people who are both looking at the statutes, but also who are applying the statutes as we currently have them. One of the things that has also come up, in talking to people in the field and in being someone, in being a mandated reporter, is the lack of clear understanding from people who are expected to report what the rules even are. And so I also think it would be important for us to consider training requirements for our mandated reporters. And I know we do have, for the Department, Child Protection has a kind of click through PowerPoint. But I really, with the complexity of mandated reporting, I really don't think that's enough. I think that some of the harm, I certainly know I used to work in the schools and teachers are mandated reporters. And I would regularly find myself in conversations with teachers saying, oh, you have to report this, and me being like, this is poverty, not child abuse. And so I think that there, we could also really look more at the robustness. And one of the things that has come up as well, particularly as we have seen more unhoused families, more people living in poverty, is making sure that our laws are protective enough and explicit enough that people are not losing custody of their children because they are poor.
TPRs will. Yeah, that was, I know, that's where it always leads to. Do you see a role for Child Abuse Vermont in this?
Yes.
Yes.
Yes. And I actually would be happy to share with the committee. So I have to get licensed again, this year, and we have requirements for, CEUs. And one of the ones that I did was on, nationwide law and policy around mandated reporting and best practices. And I'd be really happy to share with the committee, that PowerPoint that might help guide some of this conversation. And that felt, because I knew I was going to introduce this bill, and I think it is really important. That felt like a really important thing for me to have a sense of.
Can you send that to Callista?
I can.
And then it will, I mean, we can look at it, but obviously behind every slide is a story. So.
Yes. Well, and I think one of the more important, the whole thing was important, but one of the more important slides I think was sort of started was, and it was given by someone who holds both a mental health license and a law license, was looking at modern best practices. And that's probably, I think, the slide that would be most helpful for the committee in thinking about how to word this bill and how to set the task force forward in doing the work we want to do to make trauma-informed, modern and reporting laws.
Well, comment just being that with some of the federal cuts that we're seeing, you know, there's a likelihood that there will be more stress in our community and more because of some of the policies that are coming down. But also I am curious, speaking of policies, and you brought up a good point. I understand the rules and the statutes, but policies, which policies are we talking about here? Are we talking about policies in schools, policies in government agencies?
In each school might be different.
Yeah, super.
Yeah, it is. And really my intent was policies at our child protection agency. How are they unfolding and navigating? And I know we've all seen horrible things that have happened when these policies are not unrolled the way that they should be, both instances where children are harmed. I mean, and instances where children are removed and perhaps shouldn't be.
So there is some work to be done
Yes,
here.
I know that.
And I know Senator Cummings has a question, but I was gonna ask, one of the things that's very striking to me is reporting, the word reporting, and mandatory reporting has always been a difficult place, regardless of when and how you take it up. And I know it will become sort of straddle between judiciary and health care and human services upstairs. So, yeah, so, but you've got to could start.
And that is what it is. Like I said, when I spoke with Jennifer Coleman, it was about a week before the deadline for bill
We heard.
language. And so this was rather hastily brought together as a placeholder for the committees to do the work to make it go forward. It's also, you know, given both of your points about the complexity and is why it's not a bill to make changes. It is a bill to create a task force.
Identify where we need
Yes.
to make changes. That makes sense. Okay, this is good. Senator Collins.
Yeah, number of years ago, we had two children die in custody.
Yes,
And there was a, were you on that task force? I was.
I was not the first one. I was on right after that. Yes, I had worked very hard to put in place our current Matthew Bernstein, our child protection.
Yes, but on the last day, it's also Doug Proceed's last day as commissioner. Finally had social workers come in and tell us about the staffing stress they were under. That you can have all the rules you want, but we didn't, during the Great Recession, apparently the whole middle level of supervisors was let go. And so these were the people that normally supervised the 20-somethings right out of school that were doing the hands-on work. And that's, I think, something that we haven't really monitored is, are we adequately staffing
Is
so
that,
that we can do adequate support for families?
is that something you want to add into the charge, the working group, to evaluate the staffing to ease within what? Within DCF, within the organizations? Yeah.
I will answer the question. The answer is no. We are not adequately staffing. And well, I know, and it's criminal, really. One of the reasons that I would recommend, thinking about having this task force really also recommend training requirements is that one of the ways that I think we can alleviate some of the pressure on that system is by lowering the number of reports that shouldn't be reported. When people don't know if they should report or not, often because of they report. And so there are many reports that come in that and that clogs the system and slows down investigations on the things that should have been reported and should be investigated. So that's one of the reasons that I'm also recommending that we look at adequate training for mandated reporters.
So, I mean, automatically just sitting here, we've identified staffing and training and in addition to the crime victim services, there are probably other things, and Matt Bernstein, so you've got.
Yes, I know it needs to change.
So we have a lot of things to put into the bill, so given where we are in the session, I think, unless I hear differently from the committee, I think it's a good place to go. And, like, you know, if you don't want to do it, you know, just we can speak up and let me know. You don't want to do
No, I just have a question. Do we have to make all those things explicit in the bill or?
it.
I think it's been ended enough that that this working group will.
I don't know that they'll look at staffing because two reasons. I would put staffing, one for the group to understand support. Secondly, for the administration, others to be responsive. If you don't put it in, they're not going to provide the data. They may, they may.
And I think putting those out explicitly makes sense to me in that you're identifying, yes, we know there's statutory changes needed, but also you may need to come back to us with recommendations about increased positions or training recommendations. So I do think, like I said, I left it very broad, knowing full well that it would come to this committee and it would need to change because I was in a crunch. And we're also, I think, identifying the complexity of what we're dealing with and why this does need to be a task force. And again, I am rarely supportive of doing reports for reporting's sake, but I do think asking this task force to come back with recommendations on those areas is going to be really important to right sizing our system of child protection.
And the Child Abuse and Neglect Oversight Committee,
that I'm working with on, but that master group seems a significant part of, as our advocate. Really, they have to investigate, as you said earlier, they have to investigate all of these reports. And some of them turn out to be important to investigate. Good. So. I think we should have a conversation with, Michelle Child. She's the, legal advisor for us, Ledge Council. And, Tanya, and I'm gonna keep you working on this with us.
Wonderful.
So that we can have that happen. Be great.
Wonderful.
And once we finish here, I think probably it's gonna have to have at least flyby in your committee from there. Have a little bill in judiciary that doesn't, I don't think it really fits. But looking at behavioral health issues and looking at the, justice centers and that.
Yes.
Okay, so looking for your help,
I would love to help.
with Michelle and, we'll try to come back here with some language based on the conversation here, and then we'll go to the next iteration, the next draft. How's that? Does that work?
Knowing that we only.
But I'm just here.
She's got it under control.
No, we can do it. We'll do it together and, you know, we don't want to go overboard on this. And remember that then if it's got a working group and it's got members who need per diem, it's gonna go to appropriations if they go there anywhere. Anyway, so see what happens.
It probably will have to go to appropriations, but most of the people that we're naming, this would be in their official role, so I think that per diems would be de minimis.
The other, Just don't put any senators on. That's pretty, right. But the other question that I have actually is, this is a big group. It's a big job. We're giving them until your original date here is November 26th.
That may be too
So
soon.
might want to extend that a little bit, and
Yeah.
I'm wondering how far we might want to extend it.
I don't know, we were tasked with redoing the entire education mapping system in 3 months,
So it
so
was you.
I think.
I would want to hear from the members that we're tasking to do the work, how long they think they would need to do the work, but I'm
Good idea.
perfectly open to extending it. I don't want to have it sit out 3 years, because I think it's really important work to be
I
done, but
don't think it's a 2-year job. I think
don't.
it's really, all these people are familiar with
Yeah.
what the problems are. It's just, how far down the rabbit hole they go with policies.
Just don't get people during June, July,
Yeah.
and August, and even into September.
I know.
So if you assume by the time you can coordinate everybody's dates, you're in pretty close to October, so figure from there.
I was thinking that something, and it's the first year of the biennium next year, so January 15th seems early. So, so let's think about it.
yeah. January 15th was what was in my head, as a possibility, because it is the first year of the biennium. And my hope, though, is to be able to do some work on changing the actual laws in the next session.
There'll be time. I think it'll be fun. This is good.
Great.
Really glad that you put the bill together, even if it was at the last minute. But, so let's stay
Yes.
in communication and we'll connect with, I'll have Calista connect with Michelle. Put together.
That sounds great.
And if anyone on the committee has ideas of what we should be putting into the draft for purposes of discussion, then let Tanya or me or Michelle Childs. The one thing I done, unless you find Michelle, I think is.
I'm happy to. I can move base with, Michelle.
Wonderful. Thank you.
Perfect, thank you. Thanks for coming in.
Yes, of course.
Give us extra work.
Happy to.
Okay,
we've got 7 minutes before Jen comes back in. So we're gonna take a little